Nuclear medicine radiography is a highly specialized field in radiography. Nuclear medicine radiographers work with medical devices and computers that create images of areas of a patient's body. They prepare radioactive drugs and administer them to patients to diagnose and treat medical conditions. Most nuclear medicine radiographers work in government hospitals, private practices, and in universities. During patient consultations or assessments, radiographers find out all of the patient's medical history, such as whether or not they have been previously exposed to nuclear medicine and other investigations to assess if there are no exclusion factors such as pregnancy or other drugs. They also explain what the procedure entails. When preparing the solutions of radioactive material, they calculate the dose according to the procedure guideline. For example, a child will get a small dose based on his or her weight. Nuclear medicine radiographers are also responsible for preparing the patient for therapy. Radioactive material is injected into a vein, inhaled, or given orally to the patient. The radio tracer distributes or circulates in the whole body and concentrates in the disease areas. The radioactive drugs will show abnormal distribution in the body compared to normal areas on the images. Radiographers then wait for a period of time before the patient is scanned in order to see the distribution of the radioactive material in the body. For example, in a bone scan, the patient is transferred to the gamma camera and placed in the appropriate position. The radioactivity creates images that map the localization of radiopharmaceuticals in the patient's body and transmits them to a computer. The radiographer should be very alert, taking note of all the reactions the patient may have during the procedure. In addition to monitoring the camera, radiographers also record the amount and type of radiopharmaceuticals used. The clinical data of the patient is then processed. The radiographer shares the results of the procedure with nuclear medicine specialists and other members of the team. Nuclear medicine radiographers are also responsible for the quality control of the equipment they use to make sure that everything is working properly. While working with radioactive material, they are responsible for safety precautions as they see to it that patients and workers are only exposed to the necessary amount of radiation. Most of the patients that come for nuclear medicine treatment are cancer patients. This can be a very difficult time, and radiographers should know how to make them feel comfortable and how to show empathy. They also see patients with other conditions such as heart attacks, kidney failure, and lung clots. If you are a technically inclined and very responsible person with good communication skills and an interest in physical science, you may enjoy working as a nuclear medicine radiographer.